This module is part of the Lynch syndrome quality improvement pathway. The pathway has been developed to enable clinicians within the cancer MDT to improve their local diagnostic pathway for Lynch syndrome and improve genetic testing uptake. The second section of this pathway has been developed to enable members of the MDT to start the genetic testing conversation for Lynch syndrome. The first step involves taking a family history. This module will last for approximately 15 minutes. This module will introduce you to taking a genetic family history for patients with Lynch syndrome. This teaching module focuses on germline genetic testing. It assumes you have identified a patient who is likely to have Lynch syndrome following their tumor screening results. This module will help you go through taking a genetic family history and drawing a family pedigree, which should be done before explaining genetic testing for Lynch syndrome. The cancer team should give the mainstreaming information sheet to the patient. Ideally, this would be given beforehand so the patient understands the nature of the appointment. The first step of the conversation should involve taking the patient's family history of cancer, which will be covered in this module. Next, discuss Lynch syndrome genetic testing, consent for genetic testing, and send an EDTA blood sample and request form to the molecular laboratory. The main aim of genetic counselling is to give information to help the patient understand the implications of the genetic contribution to disease and the familial implications related to it. The word counselling refers to information giving or communication as opposed to psychotherapy. Thus, genetic counselling means communicating genetic information in a meaningful way to patients. The counselling process could be quite emotive for the patient due to the family implications and may take place during one of the most emotional moments in their life, for example, near the time of diagnosis. During the consultation, it will be made clear to the patient that genetic testing is optional, and the patient does not have to consent to genetic testing. If you have an in-house mainstreaming clinic, you should also consider a referral to clinical genetics if the case is complex, or if the patient would like further information about genetic testing that cannot be offered by the in-house clinic. It's recommended you take the patient's family history of cancer. The best way to do this is to draw a family pedigree. This is an example of a 4-generation pedigree. You use these symbols and lines to draw a visual representation of the family. This is known as a family pedigree and can be used to teach patients about their risk. This is a male and female symbol. If the gender is unknown, you can use the diamond symbol. If the person has a diagnosis of cancer, you should colour the box. If there are different cancers in the family, you can colour or fill the gender shapes differently. For instance, you could fill in the box with stripes in different directions for each type of cancer. Draw a line across the symbol to show if a person is deceased. Write the letter D with their age and cause of death. If cancer, don't forget to also write the age of onset and cancer type. Write a letter P inside the symbol to highlight the individual is pregnant. Draw a triangle for a miscarriage. Under the triangle, write the months of the pregnancy and the gender and name if known. Draw an arrow pointing to the person providing the information or proband. Draw a horizontal line to link a couple in marriage or partnership. Break that line to mark the couple as separated. If the couple are blood related, draw a double line between them. This is how you draw the family relationships. A line of descent for the offspring and a siblings line, and so on. Twins fall together on the same individual line which separates in a triangle end shape. If they are the same sex identical twins, add an extra line. See how to take a family history and draw a family pedigree in this video, created by Health Education England's Genomics Education Programme.
John Elliott is visiting his GP today because 2 of his uncles have died of bowel cancer in the past 10 years, and he is worried about his risk of developing bowel cancer. The GP decides to take a family history to try to work out if there is a risk.
So I'll start with you then, John, if I can just confirm your details. So you're John Elliott, that's correct?
Yes, yeah.
And what's your date of birth?
Yeah, it's the 6th of March, 1975.
Okay. And just to confirm that you don't have any symptoms at the moment that you're worried about in terms of bowel cancer or anything else that you're worried about?
No.
Okay, and do you have any children, John?
No.
All right. Do you have any brothers and sisters?
No.
Okay, so I'll now move up to your parents. Are you able to give me some information about them?
Yeah, well, my mum's called Anne. She was born on 23rd of April, 1950. And my dad's called Thomas. His birthday is on the 18th of June, and he was born in 1949.
49. Both with the surname Elliott?
Yeah.
And your parents, do either of them have any health problems that would be important for me to know about?
Not that I know of. My mum wears glasses when she's reading, but that's about it.
And just one last question about your parents. Are they related to each other by blood at all?
No.
Okay. Now, when you talk about having 2 uncles who've recently, well, in the last 10 years, passed away or died from bowel cancer, what side of the family were they on your mother's side or your father's side?
From both sides.
Okay then, so I might start with your father's side of the family. Apart from your uncle who died from bowel cancer, does your father have any other siblings?
No.
So just the one brother. Okay, and what was his name, your uncle's name?
He was called James.
Okay, and Elliot as well?
Yes.
Okay, he died of bowel cancer. Do you know any details about his date of birth?
Yeah. Well, he was born on the 14th of July, 1946, and he died the 6th of December, 2008.
2008.
Yeah, he was 62.
Okay. Right, and did James have any children?
No.
Okay, so James and your dad, did they have the same parents?
They did, yeah.
Do you have any details about your grandparents?
On my mum's side.
No, on your dad's side.
On my dad's side. Well, my dad's dad was called Arthur, and he died in 1999. He had Alzheimer's, so he was in a care home for the last few years of his life.
Okay.
And he was 75. My granny was called Mary, and she had a really bad stroke in 2003, and so she passed away in hospital, unfortunately.
That same year, in 2003.
2003, yeah. She was, I think she was 76 when she died.
Okay. And both Arthur and Mary had the same surname of Elliott?
Yeah.
Okay, I'll now move over onto your mother's side of the family. And does your mum have any brothers or sisters?
She had one brother and one sister, but they're both dead now.
Oh, okay, I'm sorry to hear that. And did they all have the same parents?
No, not all of them, no.
Okay.
My mum and her brother, Stephen, they did.
Okay.
But her sister Carol had a different father.
Different father. Okay. So Stephen, is that spelt with a PH or with a V?
It was PH.
And what was Stephen's surname?
Armstrong.
And he also had bowel cancer, is that correct?
Yeah, he did, yeah. He was 66 when he died. And that was, that was the 6th of January 2016.
16. Okay. And your Aunt Carol, you said that she's also passed away, is that correct?
Yeah. She died in 2010, 23rd of October, I think. That was with stomach cancer.
Okay. And did Stephen have any children?
No.
No. And did Carol have any children?
No.
Okay, so I'll now just ask you some questions about your mum's parents. So do you have any information about them?
Well, my mum's dad, my grandpa William, he's 91, and he's still living at home. He and me grandma Dorothy divorced in 1953 was. She died of old age in 2003, and she was 80.
80.
She was 80. Yeah, she remarried again. Her second husband was Charles James, but he died of pneumonia in 2008. I think he was 76 at the time. Yeah.
Okay, and Dorothy's surname, did she take Charles's surname when she remarried?
Now I'm not so certain. Yeah, probably, yeah.
Okay. And so Dorothy and Charles are Carol's parents, is that correct?
Yeah.
Okay. And her surname was James, the same as her father?
Yeah.
Yes. Okay. Is there any other information that you think would be helpful for me to know about at this point?
Not that I can think of.
And there's no one in the family that I've missed out?
No, I think that's all of us.
Okay. If it's all right with you, I'd like to share this information with some of my colleagues and perhaps even with other members of your family. Is that okay?
Yeah, of course, yeah, no problem.
All right, thank you very much.
The family pedigree should be a diagram of 3 consecutive generations for both maternal and paternal families. Include names, dates of birth and death, and family history. If affected by cancer, write the age of onset and type. If the date of birth or death is unknown, write the approximate current age or approximate age at death. Drawing a family tree will help you in many ways. It will help you to explain the pattern of inheritance and identify affected individuals and individuals at risk. It will also help you to build rapport with your patient and to explore the family dynamics. It is also important to draw a family pedigree to assist in interpreting the results and making recommendations for the wider family. If you would like to take part in more detailed training regarding family pedigrees, the Genomics Education Programme has a short e-learning module which can be found if you follow this link. If you would like to learn more about the impact of genomics within healthcare, Health Education England's Genomics Education Programme has developed a wealth of free resources for healthcare professionals, ranging from bite-sized information through to formal training via their Masters in Genomic Medicine. You have now reached the end of the teaching module. Please contact Laura Mojer Garcia if further support is required.